My name is Brittany and I'm going to go over with you how to take care of your surgical wound. We're going to send you home with a couple extra packs of gauze to change out at home. When you take it out, it will look like this. Go ahead and fold it in half again, and then wrap it into a little square. Place it directly over the area and bite together with some nice firm pressure. During this time, you want to make sure that you keep talking to a minimum so that your gauze stays nice and in place. Go ahead and change it out every hour and a half to 2 hours. Once there's no more bleeding or the gauze has a light pink color to it rather than a red color, you don't have to bite on any more gauze. At this point, it'll just be a light trickle. You can go ahead and place a towel over your pillow overnight to help keep your pillow nice and clean. Bruising and swelling is common. If you are given a prescription for ibuprofen, go ahead and take that as prescribed, as this will help to minimize any swelling you may have. On top of that, you can go ahead and do ice packing on the outside of your cheek the next couple of days after your procedure. You can apply it 10 minutes on, 10 minutes off, or for however long you can tolerate it for. After the first couple of days of ice packing, if you notice any swelling, that's normal. At that point, we'll have you switch to a warm compress. That will help to move around the circulation in the area, and we'll have you do that until the swelling goes down. Swelling usually peaks on about the second or third day from your appointment. From then, it should slowly start to go down. You may have been given a prescription for Tylenol. You can go ahead and take that with your ibuprofen, just in case your ibuprofen isn't enough. You may have also been given a high-strength pain medication, such as Norco, to take as needed. That can be taken with your ibuprofen, but cannot be taken with any Tylenol, as your Norco has Tylenol in it already. If you were given any antibiotics to take after your procedure, go ahead and take that as prescribed as well. For your oral hygiene, don't do any brushing, rinsing, or spitting the next 24 hours after your procedure. The following day, once there's no more bleeding, you can go ahead and brush the rest of your teeth, avoiding the areas that were worked on. Instead of mouth rinse, go ahead and do warm saltwater rinses in between meals to help keep the areas nice and clean. If you had bone grafting done, we like to overpack the area with enough bone to heal in the area. So over the next couple of days, a little bit of the bone grafting material may trickle out, which is normal. We also put a protective barrier over it to help protect it and keep it in place. That's dissolvable and will work its way out on its own. Sometimes you may notice a little flap hanging in the area, or it may start to come out from the surgical area, which is normal. If this happens to bother you, do not tug on it or try to remove it on your own. Please give our office a call. We'll have you come in and we can evaluate it. For bone grafting, we also place stitches over the area. Sometimes we use dissolvable stitches, which will fall apart on their own within a week after. Other times we like to use a suture that doesn't dissolve, where we will remove that for you in about 3 weeks after your procedure. If you're a smoker, please avoid smoking for about a week after your procedure to avoid any type of healing delays. For IV anesthesia cases, one of the most common side effects is nausea. We do give an anti-nausea medication through the IV at the end. However, if you do feel nauseous once you get home, go ahead and sip on some carbonated drinks to help settle your stomach. If this doesn't help and it persists or gets worse, go ahead and give our office a call, as we can go ahead and prescribe you an anti-nausea medication if needed. For your diet, you want to make sure that you have a colder, softer, mushier diet. Things such as scrambled eggs, mashed potatoes, or yogurt. You're more than welcome to have a smoothie. Just make sure you either drink it with a cup or eat it with a spoon. No straws the next couple of days after. You can go ahead and have soup as well, but you want to make sure that it's lukewarm to cold. You want to avoid any foods that are hot temperature-wise, spicy, or acidic, so you don't irritate the areas. On about the 3rd or 5th day after your procedure, you can go ahead and slowly start to resume your normal diet. During those 3 to 5 days, you also want to make sure that you get plenty of rest as well. You can go ahead and resume any light exercising on about the 3rd or 5th day, depending on how you feel. Once you do start exercising, make sure you take it really easy, because once you do get your heart pumping, the areas can start to ache and throb, maybe bleed a little bit again. If you have any other additional questions or concerns, please give our office a call, and we're happy to answer any of your questions.